what is the best pain control for labor? Which one of the options are you looking that will work best for you? Today, I'm going to tell you what the studies show and actually what I've seen in my 20 years of labor and delivery to help you make the best choice for you during your labor. And I'm here to say it is not a choice that you should be making right now unless you are currently in labor. It is a choice that you get to make when you are in labor, and this is some education to help you make the best choice for you. I'm so glad that you're here. Okay, so which gives you the absolute best pain relief? Studies show that it is the epidural. Now, I'm hoping that that was not a big surprise for you guys. The epidural is meant to numb you from about the bra line down to about your knees. Now, you get to tailor that to what you want. Some people want to feel a little bit more and be able to move a little bit more, and some people want to feel absolutely nothing and move absolutely nothing. I am here to tell you that your anesthesiologist is aiming to take away about 80% of the pain. They are not looking to take away 100% of the pain because that 20% allows you to move. It allows your body to get some basic feedback about maybe where baby's positioning is in the womb. You don't want to feel absolutely nothing. That's probably not going to lead to the best outcome. However, if you get an epidural and you're like, this isn't working at all, I actually have a whole video on what to do if your epidural is not working for you, and I'm going to link that down below. Really quick, when you guys like these videos, it shows YouTube that it's high quality content and will show you more high quality labor and delivery content. We sure love the likes and we love it when you guys subscribe. Now, you do have a few other options. Let's go through those. The first one is IV pain medication, and the best thing about it is that it works very quickly. If you're like, I'm in pain and I want something for right now, we would not give you an epidural. We would give you IV pain medication because it relieves pain pretty much instantly once I put it into your IV. I don't have to wait for the anesthesiologist. I don't have to wait for an IV fluid bolus. It is ready to help you immediately. However, not so good on the third plus dose of the medication. It really only works well on the first 2 doses of the medication, but if that's all you need, it can be really helpful. The other thing to know, especially if it's your second plus baby, is IV pain medication usually can't be given after about 8 centimeters because it does get to the baby and we don't need the baby to come out and have a nap. We need it to cry and get the fluid out of its lungs. Now, those same things are fairly true also for nitrous oxide. It takes the edge off of the pain. The good thing about nitrous oxide is it can be given right up until you start pushing. And so it is a great option as well, but not a lot of hospitals use it. Finally, that brings us to natural pain management. So this is going to be techniques that you're using, massage, positioning, breathing. I believe that everyone, even if you're planning on an epidural, needs to have some natural pain management techniques under their belt. I have a birth class that I recommend that does just that, along with helping to make choices when you are actually in labor. I'm going to link that class down below. But natural pain management can be very helpful for labor. And I will say that I've seen a lot of people and friends who have used hypnobirthing who felt like their labor was very much pain-free. However, as a nurse, when I would hear people call their sister as I was cleaning up the room after delivery and they would tell them, I was in hardly any pain at all. And I'm thinking, I don't know if I was in the same room with this woman. Our perception of pain after the baby comes out is very different than our perception of pain while we are in labor. That is a truth that I can testify to you guys about today. So if you're looking for the thing that pretty much just takes away the pain, you're looking for the epidural. If you're looking to just get the edge off, maybe get a little bit of rest so that you can get, your feet back under you, you might want to be looking for IV pain medication. And everyone should be thinking about natural pain management and having a few of those skills under their belt as well. But if you're wanting to avoid the epidural, I think hypnobirthing can be a great option. I think I have a link. I'm going to put it down below if I do. Now, there is a lot of mistruths about the epidural. In fact, I have a whole video about the lies of the epidural. I'm going to link it up above. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth and pain management.